Thank you for joining today's webinar, Containment Feeding, Optimising Sheep Health. My name's Jodie Rizet-O'Brien and I'm one of the AWI Extension SA team. Today's webinar is supported by Australian Wool Innovation, the South Australian Sheep Industry Fund and the Department of Primary Industries and Regions. If you'd like to know more on AWI Extension South Australia, you can go to our website. You can follow us on Twitter and Facebook. Today's speaker is Dr. Colin Trengove from ProAg Consulting. Colin has been the principal of ProAg Consulting, a whole farm consultancy business based in South Australia since 1996. A farming background led to a career interest in ruminant nutrition and health, spanning employment in a range of industry roles, livestock consultancy, mixed veterinary practice, the APAL Ag Lab, primary industries, and the University of Adelaide. Cole's passion is to optimise animal health, welfare and production through a better understanding of nutrition and sustainable livestock production, and he's recently submitted his PhD on mineral nutrition in sheep. Today's webinar follows on from some highly successful sticky beak days we've held statewide during March and April. So over to you, Cole. Thank you.
Rightio. So containment feeding and optimising sheep health. So I gather many of you may have attended the recent seminars about the nutritional side of containment feeding run by Deb Scammell. And so this is a bit of a follow-up, just talking about animal health issues. And I appreciate my main slide here is not necessarily the typical containment feeding. In fact, that's more of a feedlot. But it was an illustration of animals anyway, confined and fed apart from pasture. Okay, so if we move on to the topics for today. So these are the topics that I was provided with as a result of the recent seminars. And my first one was not one of the topics, but inanition or shy feeders. And I put that up there because the last couple of days I've been visiting lamb feedlots, actually doing a survey for with the hope of developing a vaccine for pneumonia. And several of the lambs I actually did postmortems on were actually suffering from inanition. So these were ones that had failed to adapt to the diet. And obviously we're not getting the energy, and so effectively we're in a state of starvation. And hence the reason why they were euthanized. But it's just to highlight the fact that this is an issue with potentially any sheep going into a confined space or a containment area, and there are always going to be some that may not adapt to a grain diet readily. So it's important to recognise these early and pull them aside, basically either turn them back out to pasture or put them in an area where there's lower stocking rate, and they may adjust and obviously give an adequate access to an alternative feed. But that's all I want to say about inanition. So if we move on to firstly hypocalcemia, but I've just put this up as a preview at my little token touch on nutrition requirements. And so this table here is out of the NRC guidelines 2007 for nutrient requirements of sheep. And if we just work on a typical ewe, basically being around about 60 kilos, we're talking merino ewe, maybe heavier for crossbreds or maternal breeds. But this table highlights that a ewe or whether at maintenance will eat about 1.7% of its live weight daily. We sometimes round that off to 2%. So if we said 2% of a 60 kilogram ewe would be around about 1.2 kilos, whereas 1.7 is just on a bit over a kilo. And if you look at the recommended diet for a dry sheep is 8 megajoules of energy a day. 8 megajoules is an average quality hay. And if we say for a 60 kilogram ewe eating 1.7% of its body weight a day, that would equate to 8.2 megajoules. So if, as I say, average quality hay should be that good, and good quality hay should be 9 megajoules per kilogram of dry matter. But what I want to focus on here is the mineral content. And so we normally say that a dry sheep should be eating around about 2 grams per kilogram of calcium, or around, and that's around about 2 grams in this case, well, on a 1.7% intake. However, if we move through to the last 50 days or 8 weeks of pregnancy, we see down here that the percentage of live weight required to sustain that animal has gone up quite substantially, almost 2%. Almost double, should I say. If we look at that in terms of energy requirements, we see here that an energy in that latter stages of pregnancy needs a higher density diet. In other words, more megajoules per kilogram of dry matter. So it's gone from 8 up to 10. And so 10 megajoules per kilogram of dry matter is equivalent to about a kilo of grain, whether we're talking oats, wheat, barley. And if we actually do the sums here, so 2.7 of 60 kilos is, what's that about? I've got to think about that. So it's around about, say, 15, 16 kilogram, 16 megajoules for a 50 kilogram sheep, 16.2 megajoules for a 60 kilogram ewe. So we've gone from 8.2 for maintenance up to 16.2 for an animal in the last 8 weeks of pregnancy. And so that's often something that people fail to appreciate, that the incredible rise in energy requirements for the late pregnant ewe. And so no longer is a bale of average quality hay suitable. Now we do need to be getting into a higher density diet, which is generally at least a substantial proportion will be grain. And correspondingly, we see as the animal gets into those latter stages of pregnancy, the fetus or fetuses, the bone development is occurring, and so there's a much higher requirement for calcium, and especially when you go through to lactation, because the ewe is putting a lot of calcium out in the milk. And so here we see that the calcium requirements have actually quadrupled. They've gone from 2 grams from a dry sheep at maintenance through to 8 grams in that last 6 weeks of pregnancy. And it doesn't, that sort of plateaus out a bit when we get into early lactation. But needless to say, we've got a 4-fold increase in calcium. And so where's that going to come from? As we introduce grain in the latter stages of pregnancy, grain is notoriously low in calcium. It's actually got a phosphorus calcium imbalance. And so you can't be relying on adding grain to the diet to ensure that there's enough calcium in the diet. So we really do need to provide a calcium supplement in that last, from the last 50 days of pregnancy onwards. Okay, so, and I just realised this is out of order, but anyway, one of the issues with putting animals onto a grain diet is that you risk causing what's colloquially known as grain poisoning or grain overload. Technical name is acidosis. And the reason that this occurs is introducing animals onto grain too quickly. In other words, some people try to accelerate that, putting them onto a full grain diet in 1 to 2 weeks. Now, with some supplements, you are able to achieve that, but most of those are no longer available, such as escalin, which was commonly used to introduce them onto a full grain diet in a week. But that's sort of no longer condoned because it is an antibiotic. And anyway, the consequence of introducing onto grain too quickly is a rapid drop in the pH. The pH in the rumen drops below 6 from all the lactic acid produced from the quick digestion of that grain in the diet. And as a result of that, it causes the microbes in the gut to die off. And if you get a substantial reduction in the microbial population or the biome in the rumen, that results in an endotoxic shock. The animal's rumen is no longer able to digest grain, but the shock as a result of that often will cause sudden death, or at the least, it will cause them to be dull and depressed. You may see lameness develop. They become recumbent, in other words, go down on their haunches or on their side, become inappetent. And over time, depending on what degree of damage has been done to the rumen microbial population, they may slowly recover, or otherwise they suffer sudden death or may die over the next few days. And so when you do a post-mortem on these animals, you'll open up the rumen, you'll find it's just full of grain in a undigested or semi-fermented state. And okay, you can say, okay, there's a lot of grain there, but it doesn't necessarily mean that was the cause of death. But if you use a pH stick, which is what this little instrument is here, and put in there, you'll see the pH is somewhere between probably 5 and 6. whereas it should be well above 6. In fact, it should be very similar to what the ideal pH is in the soil, which is around about 6.2, 6.5. So as soon as that pH drops below 6, you kill off a lot of the microbes that basically facilitate the fermentation and digestion process in the rumen. What can we do about it? Well, if you look up the textbooks, they always say, "Oh, give the animal a drench with 2 or 3 ounces of bicarb soda," which is really not having a lot of impact. You really need to put in anywhere from 200 grams up to a kilogram of bicarb soda, because if you think of the rumen being a 35 to 40 kilogram vessel or vat, you really need to put a lot of bicarb soda in there to raise the pH. Essentially, bicarb soda is an alkalizing treatment. So you're trying to bring the pH back up to that 6 to 6.5 range to stop the damage. And so if you're putting in at least two to four cupfuls of bicarb soda, drenching it or mixing it in water and drenching it in, that has some benefit in raising the pH. A better option is actually to potentially drench pick up a bit of fresh dung from a few healthy animals and mix it into a slurry and drench that down. And that's going to be much better, because even though fresh dung, most of the bugs are being killed as they pass through the gut, there's still about 10% or more activity of microbes in that fresh dung. So by grinding that, well, not grinding it up, just make it into a slurry and drenching the animal, you're actually repopulating the rumen with some healthy microorganisms. So that's a far better option to re-establish pH and rumen function than just to give them a big dose of bicarb soda. But best of all is actually if you're able to get gut content from a healthy animal, in other words, where you've still got all the live microbial activity, you only need 100 ml of that solution, and that's a 3-star. That's a far better option to re-establish a normal gut for the animal. So especially in valuable animals, it's well worth getting gut content from a healthy animal and drenching those valuable animals that have had a bit too much grain. How do we do that? Well, you can actually have a sacrificial animal and take the gut content from that animal and drench it into the suffering animals, the ones that are suffering the ill effects. Or otherwise, you can actually, from a veterinary perspective, you can put a little stomach tube down the rumen, pump 1 or 2 litres of water into the rumen, and then siphon it back out. And that way, you're getting quite a healthy slurry of fresh microbial organisms to then drench another animal that's suffering from the grain poisoning. However, from a preventative perspective, far better to just introduce the grain slowly. It's always recommended to do it over about 3 weeks, where you might start with 80% hay in the diet and 20% grain. And then every 2 days, you double the grain content. So, for example, if you're starting off with, say, 50 grams of grain in the ration, in 2 days' time, you double that to 100. In another 2 days, you double it to 200. Then you double it to 400, 800, and so forth. And so within 2 to 3 weeks, you've increased your grain in the ration up to about 80 to 100% of the diet. Bearing in mind, though, that if you're actually 100% grain in the diet, you're always running the risk of causing acidosis, because you really need a certain proportion of fibre in the diet to ensure that the rumen remains healthy. So we normally recommend probably at least 10 to 20% roughage in the diet. In other words, 10 to 20% of hay and not a full grain load. Another preventative is actually just to put a bit of bicarb soda in the water trough on a daily basis. Now, 2% bicarb soda, you don't want to put too much in, because it does cause an alkalizing effect, and so makes the water less palatable. But 2% bicarb soda is equivalent to about a teaspoon of bicarb in a half a litre of water, and I've drank that without too much drama. So that's quite a safe level. Okay, so moving on to calcium deficiency, and I'll just start off by looking at the big picture. So calcium deficiency can be broken down into several subheadings. So hypocalcemia, which is the true milk fever as we refer to it, which I'll refer to in the next slide. And that's the one that primarily we're concerned with late pregnant and early lactating ewes and cows, for that matter. Osteoporosis, so that's where we get thinning of the bone with age, and so all of us that are over 50 will be suffering that to a certain extent because the body becomes less able to absorb calcium as it gets older. So, for example, a 5-year-old cow or a 5-year-old ewe, the ability to absorb calcium is reduced, and also the ability to retain it is also reduced. And so we tend to lose more calcium as we get older. And so instead of having nice density in our bones, the bones tend to thin out. And that's what we call what is referred to as being osteoporosis. And so the bone is less able to store calcium and also retain its strength. And so animals do become more prone to fracture as they get older, as do humans. The next value of calcium is it's a known calcium deficiency will cause uterine inertia. So calcium, magnesium, and phosphorus are really critical to muscle function. And so if we have a lack of calcium or magnesium or phosphorus, you end up with this condition called uterine inertia, where the uterus becomes less responsive to stimuli and so less able to contract. And so going through that process of lambing or parturition becomes more difficult. And so you can end up with the case where the lamb is half out, but not fully out because the muscles have given up. And this can purely be a lack of calcium in the diet or magnesium or phosphorus. The fourth point here is poor growth in lambs. And so if lambs are achieving less than 130 grams a day in that post-lambing period through to weaning, you're more prone to having a poor growth rate. And this in turn can lead on to bone fractures. And so rib fractures is part of what I did my PhD study on. So ribs will fracture quite readily, as will long bones, actually, if the animals end up being calcium deficient, partly because they may not have got enough calcium during pregnancy because the ewe was calcium deficient, but also if they're not on getting an adequate calcium diet post-lambing, they're predisposed to bone fractures. And the last point here is osteomalacia, or common, which is the adult form, which is a malnutrition where there's not enough calcium in the diet, or rickets, which is the same condition, but referring to it in young animals and children for that matter, where that lack of calcium in the diet predisposes to weak bones. And so here is a pelvic bone with normal calcium content, so it's radio opaque or you can't see through it effectively, whereas this is a pelvis where they are suffering from osteomalacia, and so there's a lot more translucency. In other words, X-rays will pass through the bone. Anyway, that's enough about the range of calcium deficiencies, specifically talking about ewes in confinement or containment, should I say. So what we see here is it's caused by a calcium deficiency in that last 6 to 8 weeks of pregnancy. As I referred to earlier, the requirements for calcium have quadrupled, but it hasn't been addressed. And this is particularly a problem with grain feeding because grain is notoriously low in calcium. And so without a calcium supplement, animals on grain for more than about 4 to 6 weeks are going to end up with calcium deficiency. And this picture here illustrates it, where these animals are suffering from a hypocalcemia and typically got the legs sprawled out the back. And they may remain alive for 2 or 3 days, but will eventually succumb and die. It's also introduced by grazing crops and lush grass, because often these are lacking in calcium as well, without a calcium supplement. And also any stress such as yarding or droving or holding animals off feed for a period of time, and especially in the last 4 weeks prior to lambing, will predispose to hypocalcemia. And sometimes it gets mixed up with hypomagnesemia too, or grass tetany. So the signs, they appear dull and depressed, actually not dissimilar from that matter from an acidosis. But in this case, the legs typically are often sprawled out behind. The animals try to crawl along. They become, once again, recumbent on their chest, on their brisket, and lose their appetite, and often will usually die within 1 to 3 days if not treated. The other illustration here is that animals that succumb to milk fever, you'll often find they've actually got plenty of body fat. So that's quite different from twin lamb disease, where they use up all their body fat. But often it's the animals with twin pregnancies that are the ones that are most susceptible, because they have the highest requirement for calcium, meeting the needs of 2 fetuses as opposed to 1. How do we treat it? 100 mil of 4-in-1 injected under the skin. So 4-in-1 comes in various names: Calcigol, Minbul, etc., readily available from stock agencies, ag resellers. And so the a pouch of Minbul or 4-in-1 is usually about 400 mil. So a quarter of a pouch under the skin. You may give it twice a day, and maybe for more than one day, to get those animals back on their feet and going again. Often you'll get one treatment will get them going if it's only a mild dose, a mild concern. It's also a good idea to follow up with a calcium drench. So once again, you can buy calcium solutions, which is a higher concentration of calcium, so sustain the animal for longer. And sometimes you may be a good idea to give some propylene glycol, a bit of a long-acting energy solution as well, just in case it's complicated with low glucose intake. So ketol or acetol or a number of others are on the market. Preventing it, is providing calcium as a supplement in that last 8 weeks of pregnancy, and also vitamin D is a good idea. Vitamin D encourages better uptake and utilization of calcium. So vitamin D and calcium intake go hand in hand as a synergy. You can provide calcium easily as a stock lime, and a good idea is to provide a bit of dolomite as well, which includes calcium and magnesium, and sold as an appetite stimulant. So that should be 40-40-20, I notice. But that's a good homemade blend you can make, or otherwise you can buy proprietary mixes from stock feed manufacturers and trace element, should I say, mineral suppliers.
So, Cole,
The
so
other,
there's a question here. So is that
yep,
that would be someone asked, is that a calcium magnesium supplement that would be similar that you might buy?
yes,
Would
that's right.
provide the same? Yep, and
Yeah,
that's enough
calcium,
to give
magnesium,
them. Yep, while they're feeding
calcium,
grain.
magnesium. Yep, yeah, what you get off mineral suppliers, stock firms. Yeah, they often have a pregnant ewe lick or a mix or block, and that's usually got adequate calcium, magnesium in it.
Yep, for when they're feeding both on hay and grain. That's adequate.
Yes,
Yep.
yep,
Thank
for
thank
sure.
you.
Yeah, look, I wouldn't rely on hay having any more calcium than what grain does, depending on what type of hay it is. Even legume hay, which supposedly has high calcium, if you're growing legume hay on calcium deficient soils, it's going to be calcium deficient. So you can't assume that legumes necessarily have high calcium content. The other point here is, yeah, so avoid stressing ewes in that last 4 weeks of pregnancy. Any sort of stress will bring these sort of conditions on. Rightio, moving on to enterotoxemia, or colloquially known or commonly known as pulpy kidney. So this is the most common cause of sheep deaths, and for that matter, cattle deaths. And the reason being that this little rod-shaped organism is normally present in soil as a spore, and so it can last there for years, or otherwise it's commonly in the gut as well. But as long as the gut maintains a healthy throughput, in other words, they have a regular diet where things are passing through at a normal rate, it doesn't get a time to get established. But it becomes a problem. So it's a Clostridium perfringens is the particular organism in the case of enterotoxemia. It's got a few relatives like that cause tetanus and black disease, black leg, malignant edema, crow pick, botulism, etc. They're all part of the same family. But in this case, so this bacteria, if it gets a chance to get established in the gut, and that's usually as a result of a sudden change in diet, or the animals are held off feed for a period of time, or they change from one type of feed to another, in other words, going from hay to grain or from grain to green feed, that's enough to cause a disruption to the normal throughput. And especially and introducing hungry animals onto feed, especially to grain, they'll gorge themselves. That'll cause a disruption to the flow, and you only need about a 4-hour change in throughput, enough to get these bugs that are normally present in the gut to get established, release a toxin, and that's causes sudden death. You may get to see the animal before it dies, and in the case it's looking like a horse with colic, standing alone with a painful gut, head down, legs out spread wide. But usually you just find them dead because that toxining is so rapidly destroys the nervous system. And so sudden death, and commonly they will bloat and rapidly decompose because the toxin, because it's spread throughout the body, the body's almost starting to decompose before they die. And so animals are found often with this blood-tinged froth at the nostrils, and that's because the toxin causes a lot of gas. So the belly blows up, you get this compression on the lungs, and so it forces the froth out. The froth is a result of the animals dying in extremis. In other words, they were panting a lot before they died, but they die suddenly, so you don't actually see paddling. The legs haven't moved much. They've just effectively fallen on their side. They blow up and rot pretty quickly, and you'll get this blood-tinged fluid coming out the nostrils. The blood is a result of damage to the blood vessels, and typically they'll go purplish blue in the groin, and if you go to cut them open, they're more likely to explode on you. So it's called pulpy kidney because if you open them up, you'll find the kidneys are pulpy, but so is everything else. So it's a bit of a misnomer. Treatment, really none recognised. If you had antitoxin on hand, you would may be able to save a few, but that's very expensive and generally not available in Australia. You could try high doses of penicillin, and if you get in very early, you may be lucky, but usually not the case. So prevention is vaccinating with a 5-in-1 or 6-in-1 before they go into containment or as they go into containment, assuming they've had a previous dose that's primed them. And you may consider another one pre-lambing, like 4 weeks before lambing, if there's a significant gap between pre-containment and pre-lambing. Okay, so vaccination to prevent enterotoxemia and tetanus and the others that I mentioned previously. So normally we rely on, if you've given the ewe a dose of should I say vaccine prior to lambing, they will then pass on antibodies in the milk, in the colostrum, and that will provide the lamb with a protection for the first 4 to 6 weeks of life. But that's only a transitory protection because it's as long as effectively the antibodies from the colostrum will last in the system. So you really need to give lambs a dose around about 6 to 8 weeks of age, assuming they've already been covered for the first 6 weeks. In actual fact, if you give a vaccine early in that lamb's life, back here in say 2 to 4 weeks, it will actually be cancelled out by the maternal antibodies. So there's a disadvantage in giving lambs a primary dose, a primary vaccine too early, because it may negate the benefit obtained from the antibodies in the colostrum. But normally you give the first dose to lambs around about 6 weeks onwards, and then that'll provide them with around about 2 or 3 months protection. And then you need to give a second booster, a secondary dose or a booster at around about, say, 8 to 12 weeks, or it's around about weaning. And that should provide a 12-month protection. Now, I say should because if they're not subjected to too many changes in diet or stress, transport, yarding, and all those sort of things, that booster dose should cover them for most of the next 12 months, given that this brown line here is the level of protection. However, we do know that animals put under undue stress, whether it's fasting, lack of feed intake, a significant change in diet, putting them onto lush lucerne or green feed, it's a good idea to give a booster. And so they recommend actually a booster every 3 months if these animals are getting chopped and changed from different diets or being withheld from feed and then putting onto lush feed, etc. Another critical thing to remember is that we only want to use a 1/4-inch needle. So barely go through the skin. That's all we're trying to do, go through skin. We're not trying to go into muscle. We normally use an 18 gauge or even a 16 gauge, so you can actually get a good 1 mil squirt in with minimal effort. We normally go into an area that's not a prime meat cut, so we go in behind the ear where the wool is short. So don't use a 1/2 inch or a 3/4 inch needle into the spine, because when we see that we'll then often come across animals that have got spinal abscess, where someone's jabbed the needle in close to the spine or even into the spine and caused the animals to have convulsive activity 2 or 3 weeks down the track and have significant deaths. So quarter-inch needle is critical, nothing more. Okay, so moving on, I just want to mention here pregnancy toxemia. Now, this wasn't on the list, but the reason I mention it is because a lot of people get enterotoxemia and pregnancy toxemia confused. So perhaps it's better to talk about pulpy kidney in the case of enterotoxemia and twin lamb disease in the case of pregnancy toxemia. But in reality, pregnancy toxemia is caused, it's not actually a toxemia as such, it's actually controlled starvation. In other words, the animals are not getting sufficient energy in the last 6 weeks of pregnancy. So if you're supplementary feeding, you're not giving them enough. So they're digesting their own body fats and they're slowly wasting away. And if they've got twins in them in particular, or triplets even more so, those lambs are draining a lot of energy and that you will go downhill very quickly. And when you do a post-mortem, you'll find there's no body fat at all. The liver's really pale from all the fat digestion. So it's actually effective when they've starved over a period of weeks. Same signs as with acidosis and with calcium deficiency. They're dull and depressed, become recumbent and inappetent, and die after 1 to 3 days. But typically, if you do a post-mortem, you'll find they've got twins or triplets. There's no fat in the gut at all, and very pale liver. Treatment usually unsuccessful. If you think about it, they've actually been on a low plane of nutrition for several weeks, so you can't just give them a jab of gear and get them back on their feet. They usually need treatment over the next 1 to 2 weeks of a sustained glucose solution under the skin or intravenous to really get them to rebound. And so most people will give up. But you can give 100 ml of 4-in-1 under the skin. That's providing with calcium, magnesium, phosphorus, and a bit of glucose. So that's not really enough but it's a help. And you might give it, or a vet would give it intravenous initially. That's difficult to do unless you're trained in that field. But the more critical thing is a 100 ml of propylene glycol, which is that acetyl or ketol twice daily. And so that's really providing all their glucose needs, but you'd need to continue for several days, if not well over a week. The principle here is to prevent it. So maintain use in at least condition score 2.5, preferably 3 through pregnancy, and even above 3 if you've got twins, depending on where you are. If you're in the lower rainfall areas, keeping them at least 2.5. And once again, don't stress them during that latter stage of pregnancy, because that will certainly bring on the likelihood of hypocalcemia, milk fever, or this pregnancy toxemia. Next, moving on to prolapses. Now, I've actually, as I said, I've just been going around lamb feedlots the last couple of days, and I've been doing it the last few weeks actually, doing postmortems for this pneumonia vaccine development. And almost 100% of lambs I've found with prolapsed rectums have pneumonia. And so I suspect it's very much the same in ewes, but commonly it's blamed on dust, or it's blamed on short tail length, which certainly are factors, and also there's a breed susceptibility as well. But when we see prolapses in late pregnancy, and as I say, it can be rectum, it can be vagina, or it can be actual the gastrointestinal system, the intestines coming out. So it's primarily because the animal's got a very tight abdomen due to the advancing stages of pregnancy, especially with twins or triplets, and often there's a lot of fat in there as well. And so the weakest point is going to give out, and that's usually either the rectum or the vagina. And so these animals are usually in excessive condition, often condition score 4 or greater. It's often animals that are more likely to have twins and triplets, so crossbreds and maternal breeds. But I would hesitate, without guessing too much, that often these animals may be harbouring pneumonia. It may not be clinically evident, they may not have a snotty nose, or they may not be coughing, but often when you see the lung, a third or a half of the lung has got pneumonia as well. It's a very common problem in sheep and often not detected until they go to slaughter. In the case of lambs in feedlots, they're always the ones that are the poor doers and take longer to finish. And so here we have a case of a ewe with a rectal, looks like a vaginal prolapse at pasture, where in this case it's actually one that's actually prolapses all its intestines. So it's come out through either probably through the vulva, although sometimes they actually do rupture out of the abdominal wall as well. And so this is obviously fairly well beyond repair. Some animals will intermittently prolapse a bit of rectum or a bit of the vagina, and then it sort of gets sucked back in, but it may become permanent. And unless it's dealt with, these animals are going to be terminal. And so either they should be euthanized or you attempt to deal with it. And especially those that rupture the intestines, well, there's really not much hope for salvaging them. Treatment. So look, you can replace, especially if it's a rectal or a vaginal prolapse, you can actually replace it as you would with the vagina or the reproductive tract post calving, and you can apply restraining devices. So there are plastic devices that will keep things in place. Otherwise, this illustration here is just where a corded strap has been placed, so it crosses over above the tail and under the udder, so that it actually applies tension to keep those walls of the vulva together. Or you can do the same with the rectum. And so this is the harness when it's been fully applied. So it's actually crossed over above the tail, it's crossed over below the vulva to cause those the lips of the vulva to be closely opposed. So if you've replaced the vagina or the rectum, and then that strap is actually holding it from prolapsing again, and that may be just enough to get the animal through to lambing, and hopefully then once the pressure is off, there won't be any further predisposition. But these animals may well have torn ligaments that hold things in place, and so they're probably recommended for a cull after they've had a lamb or raised a lamb. Prevention: monitor the diets and condition score of these animals to ensure they don't get too fat. So keeping them under a condition score of 4. For further advice on condition scoring, I recommend you do the Lifetime U program or source some training from someone who knows. So condition scoring, we normally, in the case of looking at condition, is a euphemism for fat. We're really doing a fat score, but in this case, we're looking for the fat over the lumbar vertebrae. So we're feeling for the fat along here on the transverse processes of the 6 lumbar vertebrae, and also the fat cover over the vertical spines of the 6 lumbar vertebrae. We're also feeling for fat over the eye muscle here. And so when we say we want to keep them at a score 2.5 to 3 or better, no more than 4, out of a score of 5. And so, yeah, you need to have that demonstrated and practice it. But it's a really good measure. Animals that are in confinement, you should be looking at doing a fat score, should I say, a condition score on, say, preferably 30 to 50 animals every 2 to 4 weeks, just to see that the ration that you've got them on is actually meeting the needs of the mob. And it's by far the best method of managing nutritional status in pregnant ewes. And interesting to note that each condition score, we round it off to 10 kilograms of fat. We might split the hairs and say, okay, a merino, it's 7 kilograms of fat. In a crossbred, it's 10 kilograms of fat. But that roughly equates to 300 megajoules. And if you think a ewe with twin lambs at the point of lambing needs 30 megajoules of energy a day, in other words, 10 kilograms of fat is one condition score. One condition score will actually feed 10 ewes at the point of lambing. So that condition score is a very valuable fat store to enable animals, if their diet is not being met by their energy intake, you can make up for it with a bit of fat off the back, so to speak. And so when we talk about ideal condition score for lambing, So we normally say around about score 3. In other words, you can barely feel those short ribs if you run your fingers over them, or barely feel the lumbar spine here. But you can see these animals are nicely rounded, not too fat, and so they're very in robust condition to go into lactation and meet the needs of potentially twin lambs. To put a bit more of a detail on that before we go into lambing issues. So if we talk about ewe mortality, especially in the lead up to lambing and condition score, so we can say that if animals are maintained in a minimum of 2.5 condition score, potentially you shouldn't lose any more than about 3 or 4% of twin lambs or 1.5% of single lambs. And in the case of animals that are in a lighter condition, so if they're only about score 2, you can expect that the loss of singles will be at least double that, so up around 4%, and the loss of twins will be almost doubled, around about 6%, because these animals won't have enough energy to meet the needs of lambing and lactation, and for that matter, lamb growth in the latter stages of pregnancy. To look at that another way, we can say that the pre-lambing condition score, and this was done on about 5,000 ewes. So we see here that the mortality rate drops off quite steadily when you get down to about 3 to 3.5 condition score. But once you get into condition score 4 or more, the ewe mortality rate goes up again, and that's because of these other conditions such as rupture of the guts, or these ewes are more prone to having dystocia or difficult lambing and dying during birth. So yeah, this ideal condition score is around about 3 to 3.5. That's where you've got the lowest ewe mortality and also the lowest lamb mortality. So the latter stages of containment, we really need to be focusing on keeping these ewes in this condition here so that they're primed to go into lambing. So when we talk about lambing issues or dystocia, difficult birth, essentially probably the most common cause is the fact that there's a lack of room for fetal rotation. So all fetuses, whether we're talking human or calves or lambs or kids or whatever, they tend to rotate in the latter stages of pregnancy to go into the normal position. So this is the normal presentation, the head and the 2 forelegs coming out in this fashion. But if they aren't allowed to rotate because of confined space, then we'll end up with animals coming out either breech or 1 leg forward or 2 hind legs forward, and a head back and so forth. And so all these are going to be difficult for the animal to give a delivery. Potentially, if you've got 2 hind legs coming out, they can deliver it. But and obviously the normal presentation, but all these other presentations are going to be problematic. You can actually have hormonal interference that will cause dystocia too. For example, if they're on estrogenic clovers or medics, that can actually, the hormonal interference will impact on the animal's ability to go through parturition or lambing. And so you'll often have animals dying with a lamb half out unless it's been attended to. So it's that uterine inertia similar to what I referred to on a low calcium diet. Ideally, we avoid lambing using containment, as ewes prefer to be often their own when they do lamb, and then also it reduces disease risk, as I'll come to shortly when we talk about some of the infectious causes. So signs, if the water bag is present at the vulva and hasn't burst and the lamb hadn't been delivered within about 20 minutes, I wouldn't hesitate to go in there and pull the lamb out. Certainly that's what we do with calving. Lambs are no different. So if you've seen that animal off on its own straining to lamb for a half an hour or more and it hasn't done the job, I would actually go and stick my hand in there and pull the legs out, or make sure the legs and head are presenting. And if you do see 1 leg out or a head and 1 leg out, obviously there's a difficulty there, and so you need to get in there and help it. And I guess preferably people with small hands, it's a lot easier. The other one is if you see a tail hanging out on them, obviously it's a breech birth, and so they do need help. Otherwise, they're not going to be able to lamb on their own. From a treatment perspective, and I must admit here that often people say, look, leave nature to its devices. If the ewe dies having a lamb, well, that's bad luck. But often it can be a human error in terms of having them too fat or calcium deficient, and multiple births limiting the space. So I don't really subscribe to the idea of leaving it to nature to take its course, because if you think of the value of ewes and lambs, they are coming back up again after a bit of a dull spot last year. But I think it's well worth intervening. And so often it's no fault of the animal that they are a malpresentation. It can be a nutritional aspect, either too much nutrition, or it can be a mineral deficiency that's presented that way, or just a bit of misfortune. So, so not much hassle to go in there and help. So from a prevention perspective, close monitoring of ewes to detect and treat early. And so if you see this situation where you've got a swollen head out in one leg, well, you know that that lamb is going to be most likely going to be dead if it's already got a swollen head, and the ewe is going to die as well. And so, you know, you potentially lost $200 or $300 if you don't intervene. So whether you've got 20 pet sheep or 20,000, I think it's well worth the effort to check on animals occasionally, if nothing else from a welfare perspective. Campylobacter, or commonly it was used to be known as vibriosis. So Campylobacter fetus is the main causative organism, but there is also another one, Jejuni. And I'm hasten to add here that fiddling around with a lot of these reproductive infectious diseases, they are also zoonotic. In other words, you can acquire these infections as well. So don't just go in there boldly with bare arms and a bit of soap and water. If you're doing any assisted births, I would suggest you use gloves, or at least make sure you wear a face mask and give your arms a good scrub afterwards. And if you've got any cuts or abrasions, I wouldn't be going in there without gloves on. So the main cause of infectious abortion in South Australia is Campylobacter. I mean, there are others. There's toxoplasmosis, salmonellosis, uh, and chlamydiosis, for example. But Campylobacter is certainly the most common one. And it's usually as a result of ingestion of contaminated feed or water. It may be recent introductions of contaminated or sheep that are carrying the organism. High stocking rate encourages greater risk. Stress is also a greater risk. And look, occasionally you hear a neighbour has actually had an abortion storm, and then birds and foxes or whatever have carried membranes across the fence, and so then the neighbour gets the problem as well 2 or 3 weeks later. And so if you see some premature lambs lying around the paddock, stillborn or prematurely born, with a few membranes laying around, you'd have to be suspicious that there may be an infectious abortion occurring. Now, abortions can be caused just by stress alone, so it doesn't necessarily have to be an infectious organism, but it's something to be wary of. So if you're seeing abortions in that last 6 weeks preterm or before birth, pregnancy is, should I say, parturition is due, or if you've got stillbirths, a number of lambs being born dead, you'd have to be suspicious. And if you find an abortion and then 2 or 3 weeks later you have a few hundred ewes going down aborting, well, you know you've got a problem. So it's a good idea to take cognizance of or take notice of lambs that are being stillborn in the paddock. And if it's above, 1 or 2%, I'd be saying, well, perhaps we need to be looking a bit more closely at this, perhaps spread the ewes out. Or if you knew which ewes actually had stillborn lambs, I'd be isolating them from the rest. And actually, I'd probably move the ewes out of that paddock, because all these dead lambs and aborted membranes are going to be highly contagious. And as sheep and cattle are, they tend to be inquisitive and come up and sniff around here, and they'll pick up the infection pretty readily. And if you see ewes with membranes hanging out and sort of no live lambs, that's also going to be obviously a suspicion of an abortions occurring. So treatment, I realise it's near impossible to isolate affected animals, but that's the ideal. Reduce the stocking rate, so you're reducing the risk of spread, cleaning up aborted material and fetuses, antibiotics of marginal value, because generally, often the problem will have occurred, the animals will be infected, and an antibiotic at this stage is not going to do much good. Some people try it, some people don't. You may give blanket antibiotics over animals that haven't aborted, but you never know. The stress of getting them in may actually bring things on. There is a Campivax vaccine in Australia, and so people and there's a lot of herds around, should I say, flocks around South Australia now that have actually had Campylobacter abortions, and so they now routinely will vaccinate with Campivax, generally in maiden use. The thing about a lot of these infectious abortions is that the animals acquire essentially a lifelong immunity once they've had that problem. So it doesn't tend to recur in the adults, but maidens that are introduced into the flock that haven't been exposed to the bug are potentially susceptible. And so you'll see this a range of fetuses that more full-term fetuses as a result of these infectious abortions, but they only represent probably 10% of lamb loss as a general rule. And management issues are far more important. How are we going, Jodie? Time-wise, we're all okay?
Yep, no, we're doing great. Thanks, Cole.
Okay. So pink eye, it's actually, once again, it's a bit of a misnomer, but I won't bore you with the long term, the veterinary terminology. The cause of pink eye is there's a half a dozen different organisms. The most common one in sheep is actually a bit different to cattle. So mycoplasma is the most common cause of pink eye in sheep, but mycoplasma does occur in cattle, and about cattle, it's not the main cause. And so what we tend to see is an ulceration. So the cornea becomes cloudy. The cloudiness just represents fluid or inflammation in the cornea. And of course, you see this influx of blood vessels as well. All breeds are susceptible, considered to be spread by dust and flies and grass seeds. But interestingly enough, you can actually see it in the middle of winter just as much as you can in the middle of summer. So I think this isn't the be all and end all, the main causes. I think a lot of the time it's a poor immunity. Animals that haven't had a well balanced nutrient diet, hasn't had their share of vitamins and trace minerals, and so that can be as a bigger problem in summer as it can be in winter. So what we see, severe conjunctivitis, that ulceration, as I referred to, cloudy cornea, and most animals do recover in 1 to 2 weeks, but some develop this particularly nasty inflammation, and the eyeball may rupture. Now, interesting enough, this is actually scar tissue. It's not a ruptured eyeball, so that actually can recover, but it will actually always have a bit of a scarring on that eyeball. But unfortunately, they're blinded at this period, and so if they run into a stick or something, they're more likely to rupture it. So that's one of the downsides. Treatment. Now, traditionally, people have used purple spray, the old eye spray, and look, that's next to useless in my opinion. Oxytetracycline only lasts in the blood system for 8 hours. So if you give them a squirt in the eye with purple spray, which is oxytetracycline, not much is going to be absorbed, and it's all going to be gone within 8 hours. And so really, unless you're treating them twice a day or 3 times a day for a few days, a purple spray, you might as well squirt it in the windows in the eyeball. Not to mention, you can imagine what it's like having that squirt in your eyeball. You wouldn't like it yourself. Powders, similarly, are pretty useless. They just clog up the eye and actually probably impede healing. You can get pink eye ointment, which has a long-acting antibiotic, orbanin, but the long-acting orbanin doesn't treat mycoplasma. It's actually more effective in cows or cattle because the long-acting orbanin is useful there. So the pink eye ointment may work in some cases in sheep, but essentially you're far better off to give them a shot of a long-acting oxytetracycline, so tetroxy or alleamycin, but you've got to go the long-acting one. That'll last in the blood system for about 3 days, and that's usually long enough to effectively cure these sort of situations. Alternatively, cut up a bit of your jeans, make it into a little top hat, and glue it over the eyeball. So effectively, you're keeping sun and dust and flies and whatever out of the eye for a fortnight. And by the time that drops off, the eye will have healed. So that's another way. You can actually buy little cones or top hats. You don't want it lying flat on the eyeball because that's just going to make it worse. It's actually going to scarify the cornea and potentially make the eye worse. So it's got to be tented up away from the eyeball. Prevention, close monitoring of sheep to detect any early signs, and ideally treat those animals and preferably even spread them, because if it is being spread by flies and dust, it's actually going to go from the infected ones to the non-infected ones. There are certainly animals that are going to become susceptible. So just like any disease or vaccine program, some animals have an innate immunity or a genetic immunity, but also vitamin A protects the skin from a lot of infections and skin, including the cornea. And so vitamin A, and it usually comes with the D&E injections in that as you put them into confinement. That lasts for about 6 weeks. That's another way of reducing the risk. It also helps with lambing, parturition. The vitamin D improves calcium utilization, so you get better contractility. Vitamin E is a disease preventative. It's a immune stimulant, so that improves the animal's protection against both diseases around the time of lambing, but also from pink eye. So summing up, I think that's getting pretty close to my end of story. And so just to summarize them, grain feeding, so including a lime, dolomite, salt mix as a routine, or buying your pregnancy blocks and licks, such with high calcium, high magnesium, is a good idea as just a general supplement. The lime is providing calcium, the dolomite provides calcium and magnesium, and the salt is an appetite stimulant. Alternatively, some people just put out a stock lime and salt mix, depending on where you are. If you're in a higher rainfall area, I certainly recommend magnesium supplement as well. Vitamin A, D, and E, preferably given in that latter stages of pregnancy for the reasons specified. The clostridial vaccine is a good idea, just once again to protect the ewes in the latter stages of pregnancy, because they're under more stress at that point in time. A lot of the protein the animal is eating is actually going into the fetal development, the flesh development, as well as the antibodies to go into the colostrum, is all protein. And so if you've given them a pre-dose with this vaccine, it's going to be means the animal's better protected, and will also have a more useful colostrum for the lamb immediately post-birth. Providing ad lib hay, straw, and roughage, just as a backup, I suppose, to ensure that they have got enough in their rumen, so they're not getting predisposed to acidosis or grain overload. Providing macro and trace element supplements, either as a drench or a lick, or even as a water medication. And so some of those water medications, for example, you only need to put in the trough every 6 weeks. So, or having an ad lib loose mix, which you can either get made up yourself or otherwise buy it from the stock feed manufacturers, resellers, and ag resellers, whichever is most suitable. But I think you can't give an animal too many minerals and vitamins in that latter stages of pregnancy. And it's quite a contrast to cows, where we actually advocate not providing calcium in that last 1 to 2 months of pregnancy to encourage their bones to provide their calcium stores. But in the case of sheep, they don't actually have a lot of calcium stored in the body. So they're relying quite heavily on what they consume. And as I said, grain is low in calcium, dry feed is low in calcium, and for that matter, lush green feed is also low in calcium. So they're really only getting an adequate calcium in the diet in the latter stages of winter, spring, when the plants are fully developed roots and extracting the most calcium from the soil. And especially in acid soils, calcium is notoriously deficient, and so the plants and animals are going to be deficient as well. On that point, I'll finish up by saying, ideally post-containment, for lambing, the situation will be hopefully like this. Plenty of green feed on offer to ensure the animals or the ewes are able to produce plenty of milk, and meet the needs of the twin lambs. So on that point, Jodie, I'll pull up stumps.
Thanks, Cole. Cole, we had a question right from the beginning. We were talking about the nutrition, like the needs of ewes at different stages. And
Yep.
someone said, how much would those numbers vary for ewes with twins?
Okay, yeah. So if we say in the case of a late pregnant ewe in that last 6 to 8 weeks, it needs about 16 megajoules a day. A ewe with a single lamb will be 1.5 times that. So that's about 24, 25 megajoules a day. And a ewe with twins is double that. So it's going to be around about 32 megajoules a day. So if you think about if we just say, for example, a kilogram of barley as fed, and I make the point there that when we have a feed test done, you might find that barley is around about 12 megajoules per kilogram of dry matter, but as fed, just the same as the oats and in the silo or the cornflakes in your pantry, they've all got 10% moisture in them. In other words, our normal environment has got 10% moisture. So every feed that's available has got 10% moisture in it. That's obviously, preserved feed. And so instead of barley having 12 megajoules when you feed it out, 1 kilogram of barley will have 10% less. And so it's only got 11 megajoules. So effectively, if we say a ewe in the latter stages of pregnancy, ideally would need to be eating about 1.5 kilograms of barley to entirely meet their energy needs. Once they come through with a single lamb and need 25 megajoules a day, that's actually going to be, just over 2 kilograms of barley a day. And a ewe with twins would actually need nearly 3 kilograms of barley a day to entirely meet their energy needs. Now that's going to kill the ewe. You'd never do that. That's why it's important to have ewes in good condition so that they've actually got at least 10 kilos of fat on their back that they can utilize when they cannot possibly eat enough grain to meet their needs. And so that's why we say ewes should be in score 3 or better, 3.5, so that they, if they're only eating, say, 15 megajoules a day from their diet, they can get the other 5 or 10 megajoules from utilizing the fat off their back. And so we expect the ewes to lose a 0.5 to 1 condition score in the next 2 to 3 months during lactation as their lambs grow. And so, the requirements for a ewe with twins peaks about 20 days post lambing, so roughly 3 weeks post lambing, and that's going to be around about 30 to 35 megajoules a day. And so that's why it's so important to have them in good condition. You don't want the ewes to be utilizing any more than half the energy requirements coming from their fat. In other words, you want at least over half the energy to be coming from their diet. So that's where it's important to, in the case of grain feeding, to meet their needs with grain. But ideally, you're putting them on a green feed, which is quite an energy dense diet. So they're getting more than half their energy from green feed or grain. And so no more than about a third, less than a half of the energy coming from fat off their back. If they're utilizing too much fat, that's when they go into twin lamb disease or ketosis, and very difficult to retrieve them from that.
Yep, on the same slide, Cole, is there enough phosphorus in the grain, barley that they're feeding ewes for late pregnancy?
Generally there is, yeah. And so I've mentioned here that grains typically have a calcium phosphorus imbalance. So all living things with a skeleton, from a flea upwards, needs about 2 to 1 calcium to phosphorus in their diet. And so typically grains have a 1 to 2 ratio. In other words, it's inverse. And if you think about that, we always put out phosphorus to ensure grain grows. We don't necessarily always put out calcium. And in fact, a lot of our cropping soils are actually acidic soils with a calcium deficiency. And that's why we tend to find grains are typically 2 to 1 phosphorus to calcium instead of 2 to 1 calcium to phosphorus. And so we need to provide that extra calcium. But generally, grains are going to have an adequate phosphorus intake because most people ensure that they get good yields by putting out phosphorus supplements. And so we don't need to generally supplement phosphorus in that pre-lambing period.
Cole, our last question is related to CAMPHY. And the question is, what's the ideal vaccination program or timing for CAMPHY? Now, I'm happy to take that on notice, or if you're happy to
Yeah,
answer
no,
that.
that's right. Yeah, so normally, like all vaccine programs, well, perhaps I'll go back to the illustration here. This can just as equally apply to Campylobacter as it does to heterotoxemia. Now, the idea is that if a ewe has been exposed to Campylobacter and it's got a natural immunity, it will actually pass some of that immunity on to the lamb, but that's really of no value because the lamb is not going to be the one suffering the abortion. But the important part is that a ewe with a protection uh, will not suffer that disease again. And it's actually the problem with the maiden ewes. They come along, and if they haven't been exposed to Campylobacter prior to joining and they acquire that infection during pregnancy, they are highly likely to abort before full term. And so you need to give them the same as any other animal vaccination program. You need to give them a primary dose and then a secondary dose 4 to 6 weeks later, and then that should last that animal through that pregnancy. And we talk about a population immunity. So just like with COVID, we basically were all meant to get a vaccine so that 90% of the population was covered. And in effect, to a certain extent, we are spreading virus amongst ourselves and providing a certain degree of population immunity thereafter. The same happens with the Campylobacter. If you've had a Campylobacter abortion storm go through your flock, there'll be a level of immunity thereafter. And it could just be that your maiden ewes will get exposed to that virus, sorry, should I say bacteria, and will not then subsequently suffer the risk of getting infection and abortion. But if you've, but it's a risky period because you don't know if those maiden ewes are being exposed or not. So ideally, you would do the double vaccination program in your maidens, and thereafter, if you've had Campy in your flock, there's a fair chance that there'll be an ongoing immunity that will keep them protected thereafter. But each time you bring in your maidens, giving them a double dose of Campy prior to birth, or during, ideally, perhaps at joining, and then 4 to 6 weeks later, that'll give them protection through that first pregnancy. And thereafter, you'd hope that population immunity will sustain them. So you're really only focusing on giving your maidens a vaccine program. Some people take a risk and say, okay, well, I've had an abortion storm, I lost 1,000 lambs or whatever, and the bacteria is going to be in my flock thereafter. And hopefully with having your maiden ewes mixing with your adult ewes, they're getting exposed. But it's a bit of a lottery. You can never be sure.
Colin, another question here. How long does the CAMPHY bacteria exist for?
So yeah, Campylobacter can potentially survive on pasture in moist conditions for several weeks. So I guess when normally most lambs are going to be on green feed, and especially if it's in membranes or in an aborted fetus, potentially it could survive for a few weeks. But once it's dries out, yeah, that's the end of it. So it's unlike heterotoxemia, which forms a spore that can survive for years in soil and pasture. The Campy requires moisture, and so you'd expect if sunlight, ultraviolet light, will knock it off pretty quickly. But if it's in a moist environment, it can persist much longer.
Thanks for that, Colin. And I might say, if you want to know more about Camphy, there's some more information on the Sheep Connect AWI Extension South Australia website. And there's also a few webinars that we've recorded on Camphy in particular. So please go back and revisit those. If you can't find them, flick me an email and I'm happy to send those out to you. Just a reminder, today's webinar was recorded. We'll upload the recording in the coming days to the AWI Extension South Australia YouTube channel. And we welcome you to revisit that webinar yourself or share it with colleagues. I want to thank everyone who's joined us for tonight's webinar. And in particular, I want to thank Colin for sharing your insights and expertise. If you've got any other additional questions, you can contact me directly using the contact information on your webinar registration. We thank you for your time and have a wonderful evening.